Hello guys, welcome back to my channel. This is Nurse Faith Health Hub, where everything that concerns health is being discussed. If you are seeing my face for the first time, my name is Nurse Faith. I am a registered nurse, a registered midwife, and a Bachelor of Nursing Science degree holder currently practicing in Nigeria. So in today's topic, we're going to be discussing about dysmenorrhea. What is dysmenorrhea? Dysmenorrhea is a medical term that simply means painful menstrual cramps. Okay, why some women have pains during their menstruation, some other women do not have any pain during menstruation. So dysmenorrhea is of two types. It's either primary dysmenorrhea or secondary dysmenorrhea. Then what is the difference between both? Primary dysmenorrhea, there is no underlying cause. Okay, there is no medical condition or medical disease or any disease condition that is causing it. Why in secondary dysmenorrhea, there are a lot of issues that can cause secondary dysmenorrhea. In primary dysmenorrhea, it starts very early. Okay, let's assume that a woman sees her first menses in life at age of 14, maybe at age of 15 or 16, painful menstruation may commence. Why in secondary dysmenorrhea, if a woman sees a menses maybe at the age of 14, the woman may not be having any pain all through until maybe at the age of 25, 26, 24, depending. Okay, so it starts later in life. Why in primary dysmenorrhea, as the woman ages, okay, while the woman advances in age, the pain goes down. Why in secondary dysmenorrhea, as woman is aging, the pain increases. So these are the differences between the primary and secondary dysmenorrhea. Then another difference between both of them is that the cause of primary dysmenorrhea is as a result of prostaglandin production. Prostaglandin is a hormone-like substance that is being secreted in the body during menstruation. The work of this prostaglandin is to do what? Is to cause the womb to contract, or uterus. I want everybody to be following and be flowing with me. Okay, it makes the womb to contract so that the blood that is already accumulated in the womb in form of menstruation cannot go off. And remember that is this prostaglandin that is responsible for labor pains during labor, because during labor prostaglandin is also produced in order to make the womb or the uterus to contract in order to push out the baby. So that is the cause of primary dysmenorrhea. But what happens here is that during painful menstruation, the prostaglandin is produced in a big quantity, more than is required. This will make the woman to experience pains. Why in secondary dysmenorrhea, together with this prostaglandin production that will induce pain, there is also another underlying health conditions that can precipitate it. For example, fibroid can be a cause of secondary dysmenorrhea. Also, there's what we call endometriosis. Remember, I mentioned, I say medical conditions. I'm not supposed to be discussing all of them in this video to avoid unnecessary long video. I will still talk about all these conditions in my channel here. That is why you should put on your notification bell, so that once I upload new video, you'll be able to get it and follow. Okay, so fibroid is a cause of secondary dysmenorrhea in the sense that fibroid is abnormal growth in the womb. So when the womb is contracting to push out the blood, the fibroid will be a kind of resistance, okay, to be resisting and be causing pain in the woman's womb. Okay, so that is it. Then endometriosis is when the tissues of the womb, okay, the lining of the womb, I will talk about it and explain it very well in my subsequent videos. So when it grows where it's supposed not to be, it's supposed to be only inside the womb, but sometimes we find these tissues outside the womb, maybe at the covering of the womb inside, instead of inside the womb. It will be at the back of the womb, or it may be at the ovaries or the fallopian tubes or any part of the reproductive organ, or it can even be outside the reproductive organ. So when this occurs, during the menstruation, the woman will be menstruating. The one that is in the womb will be flowing out through the vagina, while those ones that are in other places like the fallopian tubes, the ovaries, all these things, they will also be coming out, but they cannot go out from the body. They will be accumulating somewhere. They will be deposited in the surrounding structures or surrounding organs of the body, thereby causing pain. That is it. Then another cause of secondary dysmenorrhea is adenomyosis. This is when the tissues of the womb, the one that is supposed to be in the inner lining of the womb, instead of it to remain there, it will not tear and go into the muscular part of the womb. Okay, in muscular part of the uterus. I'm using womb so that everybody will understand what I'm saying. So when it grows into there, it's another issue, and there are causes of that. All these things, they are medical conditions. Another cause of dysmenorrhea is what we call PID, pelvic inflammatory disease. Is a serious infection that some women suffers. So any woman that has PID is likely to be experiencing severe menstrual cramps during menses. So these are the differences between the primary dysmenorrhea and secondary dysmenorrhea. And there are treatment regimen. We have synthetic treatments and natural treatments, which I will still discuss in my another video. Okay, so with this, we've come to the end of today's video. If you find this video helpful, please don't forget to like, don't forget to comment, don't forget to share, don't forget to subscribe, so I'll be able to be getting new videos once I upload them. Thank you very much. Thank you for staying tuned. See you in my next video. Bye.